Very few men actually come with their wives for a fertility consultations, get the required test or get the required investigations, and very few men would actually admit to having a problem with them. And when the problem is a performance issue, it actually becomes very complicated and awkward to handle. Yes, today we will be talking about the sexual dysfunction and the erectile dysfunction in men. It is a very important and till now not very much spoken about cause of infertility in the couples. In fact, in my clinical practice also, when we take a detailed history, when we probe into the matter, we actually find out that the reason of infertility is the difficulty in having penetrative sex because of various reasons, and because of the awkwardness, the secrecy or the embarrassment associated with this problem. People tend to look for magical cures from the quacks, healers or even the friendly nearby chemists. So hello everyone, I am Dr. Anjali Kumar, once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. And today, to help me with all this, we have Dr. RamanTanwar with me. He is one of the few qualified andrologists of our country. He is the editor of the Male Sexual Dysfunction Guidelines of our country. He is the editor of the Men's Health Guidelines of India also. So welcome Dr. Tanwar to Maitri.
Thank you. It's a pleasure to be here on Maitri. And I've seen a lot of videos of Maitri. It has got a tremendous reach, and the kind of work that you're doing is commendable in guiding our patients in the right direction.
Instead of resorting to all this, today let's get our answers straight from the specialists. So starting with the first question, what is the erectile dysfunction, as commonly said as ED?
So ma'am, erectile dysfunction typically is defined as inability to actually have the hardness that's good enough to actually penetrate the partner. So it can happen in various ways. For example, some patients may not have any erection at all. So they may not have an erection in the morning, they may not have an erection during the act, and some patients may be able to have an erection during the act but they may lose it midway. So these are all various forms of erectile dysfunction.
So when do you think they should report to a doctor?
I think many of the times the erectile dysfunction is momentarily something that we often refer to as performance anxiety. If that's the situation, then you can just let it be and observe it for a while. If it persists, then definitely you need to see a urologist or an andrologist.
So I was actually seeing the statistics. They said that all over ED affects almost 30 million men.
Actually, that's very, very true. In fact, if there are 3 men in this room, one will definitely have had ED sometime in their life. So it's a very important issue, but always brushed under the carpet, because men really don't know how to expose it to everybody else, how the society is going to basically take it as and probably judge them also. Yes.
So it's high time that we start at least talking about these subjects in an open and non-judgmental manner. So what causes ED?
Right, a very good question, ma'am. But I think to really answer this question, let's talk about how basically erection happens. So often, we believe that sexual activity is a function of the genital organs, but you'll be surprised to know, and how we say to the patient also in our day-to-day interaction, is that the sex actually happens between the ears and not between the legs.
Yes.
So basically the process of erectile dysfunction typically would start when the normal process of erection is altered. So when you have a fantasy, that's where the sex is actually starting from. You imagine your partner in a certain way, and then the signals will travel down the nerves to the organ through the arteries. The blood is going to fill into the sponge, and then you're going to have an erection, and then the veins are going to stop that blood from going away. So that involves a lot of disciplines of medical organ system.
I mean, logically speaking, which means anything happening at all these levels could cause
erectile
ED.
dysfunction. So it can start with something like a performance anxiety, or probably the inability to actually think right when you are in the act. If you have any fears, if you have prior sexual experiences that have not been good, these can all basically hamper. And then if you have a nerve problem, for example, if you've been a diabetic, or if you've had any backaches, or if you've had any trauma to the nerves, this can also cause erectile dysfunction. Or if you have any problem with the arteries, or if you have had a trauma to the penis, the sponge has gone bad, or the veins have become stiff because of age or various other factors, they can all lead to erectile dysfunction.
So they say that ED is actually the barometers of the men's health. Many times when a person comes to us with the ED, or a couple comes to us with this problem, we actually would want to investigate them for diabetes, high blood pressure, high cholesterol, and so many other things.
So ma'am, that's a very, very important point that you've brought out. Many of our patients, they would see erectile dysfunction as a specific problem of the particular organ. Now, this is a very wrong way of seeing it. Actually, erectile dysfunction represents the disease in its nascent form in the heart, in the brain. So we've had studies where actually we found that if there were men with erectile dysfunction, 50% of them would land up with some sort of a heart attack or maybe a stroke. In about 5 to 10 years of time. So
very important point, that it's actually not the Gupt rog, it's actually the disease of the entire body.
Yes. So we should not make the mistake of actually seeing it as just a very organ specific disorder.
So now that we have diagnosed the ED or come to a clinical decision that this is ED, how do you think that they should, the treatment should be started?
Wonderful. So ma'am, whenever the patient comes to us with erectile dysfunction, we would like to evaluate the right cause of erectile dysfunction. I think if you really want to treat it in the proper manner, in a permanent fashion, you need to figure out why erectile dysfunction is happening. So the entire list of stations, these 5 stations that we mentioned, we have to screen through them. We have to ask the patient about his prior sexual experiences. We have to figure out if there is something which is bothering this patient. So a good history taking, which requires a lot of time actually in the clinic, is very, very important to assess this patient. And then we do a few tests. For example, we can go through the lipid profile of the patient, the general body workup. Sometimes we get the testosterone also evaluated if we find there are signs of hypogonadism or low testosterone. And we usually give a small medicine to the patient, either in the office or ask him to take it at home, and figure out what was the response to this medicine. Now, this is a very important test, and sometimes often we call it the OST, or the office sildenafil test.
So the most important thing is, don't go for something which is offering you an instant or a magical cure. Instead, focus or spend time in finding out what is it which first caused the ED.
Exactly.
There have been so many movies and so many stuff which spoke about Viagra and sildenafil and so many things. So I know there are so many so-called the friendly chemists who are ready to offer you the services at whatever time. And so what's your take on that? Should a patient be doing that, or does it have some serious side effects? Because that's very, very important for people to understand.
Right. So ma'am, that's something which is very, very pertinent to today's population, because there's a taboo around this subject. So many people do not want to really disclose it or take out time and visit a doctor for this. They would just want to go nearby and take any over-the-counter medicine which is being given in good faith to them. Now, the problem with these medicines are that usually whatever medicines we typically take for sexual dysfunction, they are actually dilating the arteries a bit. And sometimes if you are a heart patient or you're not aware of a heart condition, you can land up in the hospital or even land up in heaven for that matter. So I would strongly discourage the men to be taking any of these medicines by their own. And there are so many doses of these medicines, there are so many varieties of these medicines, that the chemist would typically give you something which is very, very strong. Maybe you don't even need that, and then you kind of become an addict to these medicines. You keep thinking the next time you have intimacy that I have not taken that medicine, will it happen that well today or not? And that leads to a constant dependence on the medicine. And then you're never able to come out of the clutches of the medicine. So always start it after professional guidance in the right dose with the smallest possible dose, which is only possible to ascertain once you're properly evaluated for the cause of erectile dysfunction.
So, like you said that there could be psychogenic causes, the stress, the worry, anxiety, relationship issues. When I was researching about this topic, I came across a very interesting term, which was porn-induced ED, PIED, and I was amazed. These days youngsters are always at the internet, looking for the instant gratification. So this is where it can land them into.
So a lot of patients
want you to speak about this.
do come to us with porn-induced erectile dysfunction. Now, what exactly is this entity? So the porn has actually glorified sexual activity in such a way that when you're actually coming to face with it, when you have a real partner, you will find certain things. You will have a particular smell of that person. The hair may be of a particular texture. You may not like the hair on the skin of your partner because you've not seen it that way. You've imagined it in a very ideal manner, and actually when it is happening in real, it's not ideal. And then when the mind doesn't get what it's expecting, then people may get into a psychogenic form of erectile dysfunction, and this is one of the very common reasons of presentation to us in the OPD in the younger age group of patients.
Yes. Okay. So we've spoken about the medicines. Now there are so many people who are talking about the herbs and the supplements to cure this ED. So what's your take on that?
And since erectile dysfunction, as we have discussed, it's involving so many systems, it's very hard to really point down to the cause. So everybody would like to, experiment with it. And that's why there's a booming market for these kind of herbal things. But I am not saying that these are not effective in direct comparison to the medicines, but I would say that unless we know the cause, it's not right to take them because you never know how long you're gonna need them. There's no defined timeline on how much you should take them, and of course many of the times we don't have an exact research on the side effect of these supplements. So I only advise some nutraceuticals rather than calling it a herbal supplement. Let's call it a nutraceutical, and I would only advise it to be given as an adjunct to the main medicines that we typically give for the treatment of erectile dysfunction.
So once again, most important, get yourself investigated well. Talk to the the credible specialists in this. Get yourself investigated. Take the right medicine, and just do not go for someone which is making a simple tall promise. So now, what if the medicines do not work, or it's a bad ED?
So ma'am, we do get patients where say about 5% of the medicine won't work for them, and then what we have to do is either increase the medicine as a combination, or sometimes some older gentlemen, they can be helped with a vacuum erection device, wherein basically there's a vacuum which is created and that lets the blood flow into the organ and collect the blood there. Lastly, sometimes when the patient is actually in remand for a more rigorous sexual activity with a partner, we can go for something which we call penile implants, which are basically either silicone rods or cylinders that we place inside the penis.
What is it they can do in their day-to-day lifestyle to make the problem better?
So ma'am, lifestyle changes are a very, very important aspect when we are managing patients with erectile dysfunction. Now typically the lifestyle changes are very, very similar to what you've been advising your patients about PCOD. So in any of these situations, these particular problems, I think lifestyle changes are essentially the same. So walk for 30 minutes morning and evening, a healthy balanced diet, but more important in this is stress reduction, because we've seen that it all happens between the ears. One particular exercise that I often ask my patients to do is the Kegels exercise, which even you do. Your patients also are advised Kegel exercise quite a lot, and in this what you have to do is you just have to contract your anal region, the one from which your motion comes out, and you have to contract it for 6 seconds, relax it for 10 seconds. So this is the slow ticks that we call, and then we have fast ticks where every second you try and contract it. So those pelvic muscles, they are going to improve and the blood flow to the penis is going to improve.
Most important, smoking, not a great idea, because smoking is something which spoils your blood vessels. And I believe even the alcohol in moderation is fine, but
excess
serious
amount of alcohol
alcoholism
should
is
also be refrained from.
bad.
Indeed. So friends, as we saw, erectile dysfunction is not just a gupt rog, so to say. It's actually a disease which involves the whole body, and the sooner you actually get to a specialist and figure out the cause for it and get the treatment done, the better it is for you. So if someone was to ask me one question exactly to judge the health of a man, I would just ask him how good the erections are, and I'll practically get to know everything about the health of the man.
So it's high time that we start talking about these subjects openly and without any biases. So I'm very, very happy. Actually, I was very skeptical whether I should be talking about this or not. But I'm very, very happy that we spoke about this.
So as a men's health expert, I feel that men are still too shy to really come out with this problem in the open. So I believe, ma'am, that through this platform, at least the women can push men to actually talk about it and get the treatment, and let not this be something on their head as a hidden responsibility or as a hidden pressure.
Yes. So today, like always, if you found this information useful, please do not forget to like, share and subscribe to Maitri. And please follow Dr. Raman too. He's made some amazing videos on this subject. So thank you, and we will see you soon.